By that time, my husband was working as a teacher. And the interesting thing was that the IWO had the first of what you would call a health plan. They had doctors who would take $2 for a visit. They would do a house visit, and you paid a certain amount a year. Now, when my husband, and we joined it because this was wonderful to have.
You were a member of the IWO at this point?
My father was, and I knew that we were covered by that. So when we got married, my husband and I joined. But then when my husband was looking for a job, one of the things that they asked that you to sign was a statement that you did not belong to a
subversive
organization. So we cut off our membership on that and wrote no. And in a way, they were ahead of their times as far as the medical plan. I was 8 years old, and I had a pain in my stomach, and the doctor came to the house, and he said, she's having an appendicitis attack. And he put me in his car and drove me to the hospital. And I think that the whole operation cost like $100 through the IWO. So that was an early time to realize that this was what people needed. And so when my husband started teaching, the teachers had no benefits at all. If he had a temperature that was less than 102, he went into work because we could not afford to lose the day's pay. And so after the first big strike that the UFT had, we were given medical benefits, days off for sickness, and a lot of the other benefits, pension rights, that have made my life as an adult much easier.